good thing with hypertension is, there are plenty of drugs that you can use to treat hypertension, and there is no hypertension that can never be managed, especially amongst black patients. It's been proven that it's one of the best first-line drugs for blacks who are hypertensive.
Viewers out there, just a reminder on the theme for this year's World Hypertension Day commemoration. Measure your blood pressure accurately, control it, and ultimately live longer. So Dr. Joe, so once diagnosed, what's the next step?
So a diagnosis of hypertension, that is very important. A diagnosis of hypertension is not equal to a death sentence. I see people getting devastated once they are diagnosed of hypertension. Yes. But I always tell people that you should actually thank God that you've been diagnosed of hypertension. I've had patients that come when they've actually had complications. Someone is wheeled in on a wheelchair after having a stroke at home without even knowing that they were hypertensive. Remember, we said it's a silent killer. It's a silent killer, and we've got patients that have just died without knowing they had hypertension, only discover on the post-mortem that they had hypertension. So if you are diagnosed of hypertension out there, thank God that we now know you've got hypertension and there is treatment. The good thing with hypertension is, there are plenty of drugs that you can use to treat hypertension, and there is no hypertension that can never be managed. I hear people saying, I need yango BP,
difficult to control. We call it difficult to control hypertension.
Yes, but we can always control it. There are first-line drugs, second line, third line, fourth. There are plenty of drugs that we can use to control hypertension. There is no way, there is no blood pressure that can be controlled. I've dealt with patients that have come with BPs that are over 200. But when we work together, you as a patient, you are willing and you follow what we tell you, eventually that blood pressure will be controlled. So the good thing is there is medication that can control it. And mainly, control of hypertension is in 3 ways. Number 1, medication. Number 2, diet. And number 3, exercise.
Okay.
You need to couple these 3. You can't manage hypertension, or your hypertension cannot never be fully controlled if you're not exercising, if you're not controlling your diet, and if you're not taking your medication, especially if the hypertension is now high. Generally, there are grades of hypertension. If it's severe, definitely you need these 3. Moderate hypertension, definitely you need these 3. Even mild hypertension, definitely you need these 3. If you are pre-hypertensive, your blood pressures are now a bit on the high side, 130 to 140, the top one, the bottom one, 85 to 90. We call it pre-hypertension. It means you're now at a high risk of developing hypertension. That's when we say diet and exercise. So at that point in time, you need to diet. And on diet, 2 things that you definitely have to cut in your diet. Number 1 is salt. Make sure you don't eat a lot of salt. When your wife is cooking or when you're cooking, put just a little bit of salt. If you want something that is a bit salty or chili, it's better for you to use spices and chili. Spices do not affect hypertension. So salt, we cut. You can put spices instead of salt. Then secondly, fat. Most of your foods should be boiled foods. Boiled eggs, boiled meat, and cut on fatty foods. When you're buying meat in the supermarket, make sure you buy lean meat, especially if it's beef, with little fat. If it's your pork, make sure you cut off that pork skin. You don't eat it. If it's chicken, remove the chicken skin as well. That also helps in terms of cutting the fat, because the chicken skin and the pork skin, they definitely have more fat than the steak. So just go for the steak and cut on all these fatty foods. Then in terms of what you should eat more fruits, more vegetables, and drink plenty of water. It helps in terms of managing hypertension. On the fruit side, bananas are particularly good. They've got plenty of potassium, which helps in terms of bringing down your blood pressures. So if you're hypertensive, please eat a lot of bananas, but please don't get constipated by eating a whole sack of bananas.
Wow, powerful nuggets coming out. You mentioned number 1, adhering to medication.
Yes.
Number 2,
you need to exercise. Then lastly, diet.
Lifestyle changes as well. I've heard Dr. Joe, healthcare practitioners, also talking about issues of adherence.
Yes.
Can someone eventually stop taking medication, and are there any long-term complications perhaps if hypertension is left untreated?
All right, thank you for that one. I always get that question, and people are scared of that in the beginning, that once I start taking my medication, am I going to be able to stop taking the medication? I always give them this answer. What do you really want? To live long taking your medication or to die early without taking your medication. So the issue is not about stopping taking the medication. Us as doctors, we are not here to push drugs or to push people to take medication, unlike what most people think. The reason why we're here is to make your life better, to make sure that you don't have any complications of hypertension. So the most important thing is for you to take your medication. Or if the blood pressure comes down to a reasonable level. When I start my patients on antihypertensives, I generally tell them that it's not me who's going to make the decision to stop the medication, and it's also not you. It's the BP readings that tell us.
Okay.
So if you come here and your blood pressure, say for example, it's 160 over 100, which is a moderate hypertension, you put you on medication, it comes down maybe now at 130 over 70. Then you come back to me and be like, doc, it's not normal. So should I stop taking the medication? My answer is always, we can't stop the medication. Once you stop the medication when the BP is normal, it means it's not going to go up.
Go back high.
But if you come back to me, your blood pressure is now below normal. The top one says now 95. The bottom one is 55. Then we can stop the medication. So it's always the BP readings that give us the reason to stop, not you, not me. So taking medication is for your good. If you've taken your medication or you're exercising more and you've lost weight, stop smoking, everything has improved, your BP goes below normal, we can stop the medication. But if it's now within normal ranges, we can't stop the medication. We can cut maybe on 2 or 3 drugs, maybe we cut to 1 or less, something like that.
Wow. Thank you for those powerful insights. Are there any myths maybe to talk about that are worth debunking? I know that Dr. Google is out there and there are a lot of myths that people, a lot of us then get to come across. Are there any myths that are worth debunking in this session?
Yeah. Dr. Google is one of our biggest enemies as medical practitioners because half knowledge is more dangerous than no knowledge. It's better for you not to know anything. If you Google, then you know a bit, then you make a wrong decision. Then the worst enemy, worse than Dr. Google, the doctors at home. Ana mama nana baba vanenge vachiti ukazona mapiritsi unozodai anaya anoitisa sugar. So there are plenty of myths. I'll start with the first myth that the commonest that I think that I've heard from people. It's the one drug called HCT. I'm sure you know it.
Yes.
People say HCT causes diabetes mellitus. HCT chagomawaita sugar. It's not true. HCT does not cause diabetes mellitus. If you take HCT, it's not that it's going to cause you to suffer from diabetes. What causes you to suffer from diabetes is actually the hypertension. If your hypertension is not well controlled, eventually it will damage the arteries, peripheral resistance, remember we spoke about that.
Yes.
Then there is insulin resistance because the arteries are damaged. Then there can also be damages to the pancreas, rotata, that's the one that controls insulin production.
Yes.
So if either of the two are affected, you eventually suffer from diabetes mellitus. What causes diabetes mellitus is high blood pressure that is not well managed, not HCT. But HCT is contraindicated when you are now taking oral hypoglycemic, say diabetic drugs like metformin. There is drug interaction between HCT and metformin. So the thing is, when you come to us now, you are diabetic, you are hypertensive, and eventually develop diabetes. You are not taking a medication, well, now you've got diabetes. We stopped HCT. So when you go back home, you'll be thinking, so this drug is the one that caused diabetes.
That's why the doctor had to stop it.
Yes, we stop it because there's drug interaction, not because it causes a diabetes mellitus. And by the way, HCT is a good drug for hypertension, especially amongst black patients. It's been proven that it's one of the best first-line drugs for blacks who are hypertensive. So that's one myth that we need to demystify. The second thing is the use of herbs.
Okay.
Here in Africa, we're very traditional and we believe in our herbs so much. I need you to know that there is no herb under the sun, here in Zimbabwe, anywhere in Africa, or anywhere in the world, that has been proven to cure hypertension. Hypertension, like I said, it's a chronic condition. It's got no cure. There is no herb that can cure hypertension. So please, if you decide to take your herbs, it's your own decision. The only worry that we have with these herbs is they might also go and affect your kidneys. Remember, hypertension can also affect your kidneys. So if your kidneys are affected by hypertension and now you're adding these herbs, they are worsening the renal failure. I've had patients that eventually go to dialysis because of taking herbs when they're also hypertensive. So we don't encourage you to take herbs. But if you happen to think or you want to take them, don't ever stop taking your medication because you're taking herbs. Then the third issue that I need to talk about on this one. It's our spiritual side.
Oh,
yes, we are human beings. We go to church. Some go to whatever religious beliefs that we have. There is no nanga that can give you whatever medication to take away hypertension. And also, when you go to church, you can be prayed on, or maybe you pray on yourself and you believe the hypertension is gone. Please do not stop taking your medication just because someone said you are healed. Go back to your doctor. Let the doctor check the blood pressure. If you are no longer having hypertension, right, and they are taking your medication, you come to me, I check your blood pressure, it should go below normal. That means you are now healed. Then you can stop the medication, continue monitoring you. So please don't just throw the medication in the bin because your pastor, your prophet, or whoever it is, he said you are healed. So please, let's make sure we take our medication religiously.
Wow. Thank you, Dr. Joe, for sharing those powerful insights with us. So what is the future of hypertension management looking like? You are the experts in the field.
So hypertension in first world countries, there have been a lot of strides, a lot of improvements in terms of patient care, reduced morbidity, that is the number of patients that get hospitalized because of hypertension, eventually reduced mortality. We say here in Zimbabwe, I was reading that in Zimbabwe, if we don't improve, if we continue the trend that we're going at, and we don't improve in terms of managing our patients with hypertension, we're going to lose more than 400,000 patients within the next 10 to 15 years.
And that is so alarming.
That's too much. So because of the advancements in other countries or in the world generally, globally, there's been improvements. We've got fixed dose combinations, drugs that reduce your pill burden. So that's a problem. If someone comes and the BP is too high, maybe it's not 220 over 130, which is severe hypertension. We might need to put you on even 3-4 antihypertensives. But now with these fixed dose combinations, it means you can get one pill with 3 drugs.
3 drugs.
So instead of you taking 3 pills every morning, you only take one pill. So that reduces your pill burden. It means we've improved in terms of managing your blood pressure. And also people are generally more active nowadays. I'm sure when you are going to work in the morning, you see people jogging and stuff like that, which is a good thing. If every Zimbabwean gets in that culture of exercising every morning or find some time, we say you should do at least 30 minutes twice a week of aerobic exercising. That's what we encourage. We encourage aerobic exercising, things like jogging, rope skipping, cycling, swimming. That's better to do than weightlifting, because weightlifting is going to improve your muscle bulk, which is also going to put the strain on the heart, which is similar to the fat that you're trying to burn. So the problem is your heart is now being strained. If you're obese, your heart is being strained. Your heart doesn't change size. If you lift weights and you are big, you've got these big muscles, your heart remains the size of a fist. You know the size of the heart, it's like the size of your fist. It doesn't change. No matter how much you exercise, it remains the size of your fist. If you gain muscle, the heart is going to struggle to pump blood to that extra bit of muscle that you've gained. The same way it's going to struggle to pump blood to the extra fat that you've gained. So I encourage you to do aerobic exercising. So people are exercising more clubs, more gyms to help people to exercise and to be fit. And if we continue on that trajectory and cutting also on these Western foods, fatty foods, eat more for our traditional foods, and small portions. That's the other thing. Us as Africans, especially African men, they say, oh yes. I can't be able to see what's behind the heap of salsa in front of me. We say you should eat salsa the size of your fist. That's the maximum amount of salsa that you should eat. You can't go beyond that.
And that's a punishment for African men.
And also, we don't encourage you to eat heavy meals at night when you're going to sleep. It's better to have a heavy breakfast, or even salsa or during lunch. Then supper, make it a bit light. Normally it helps so that you don't accumulate a lot of fat because you have utilized the food that you have eaten during the day.
Thank you, Dr. Joe, for these powerful insights. And to our viewers and listeners out there, let's take control of hypertension. Remember the theme: measure your blood pressure accurately, control it, and you ultimately live longer. This podcast is brought to you in recognition of the World Hypertension Day and commemoration of hypertension. Remember to follow us on our social media handles. Follow COSFAM on LinkedIn, on Facebook, and on Instagram. Until next time, it's bye for now.